Good morning, everybody. I'd like to thank my dear friend, Dr. Srivastava, for this very, very generous and kind invitation, and congratulate him and you all and the whole SSI team on this unbelievably exceptional accomplishment and a crowning of all of the hard work that has been put into the system, which is hopefully going to change a lot in the world of robotic surgery, including robotic heart surgery. And I am a good friend and have known the progress of the SSI robot for many years now. I think just to give a little modicum of history, I first met Sudhir back in 2006 when we were doing what they called live surgery, kind of the predecessor of YouTube, where I was using anastomotic devices, and Sudhir had been very, very interested in developing a less invasive approach for coronary surgery using anastomotic devices. And we connected on the topic of coronary connectors, if you will. And then the next interaction was coming to visit him when he was at the University of Chicago, I think around 2008 or something like that, to watch the master of TCAB doing robotic multivessel TCAB surgery with two internal thoracic arteries, which was very, very novel at the time, and definitely drew some significant inspiration from what Sudhir was doing. And then eventually came down to Chicago and continued his work there. And now here we are, 5-6 years later, and we're having the first SSI Robotic World Conference. So my role is to talk about what the current landscape of robotics is in the world. Obviously, my specialty is cardiac, so I know a little bit more about cardiac surgery, but in the way of history, medical robotics was merely a curiosity before the 1990s. And over the last probably 15 years, there has been a steady growth in various subspecialties in robotic heart surgery, including urology and gynecology, which were the original specialties that were using robotics, and then following with general surgery, thoracic surgery, and TORS surgical procedures. Cardiac surgery is still very nascent in its development, even though it was the intended primary specialty for reasons we can get into later. This is a more recent analysis of the current global surgical market by application type, and you can see that the growth in general surgery here is the most significant over the last 3 years. Gynecology and urology continue to maintain a good percentage fraction of the global utilization, and then orthopedics with their own robotic systems has also been a significant specialty that uses robotics, and then others included in this is thoracic, ENT, and cardiac surgery. So in terms of worldwide, the current data, there's been 26 years of innovation for minimally invasive care. I think 60,000 surgeons have been trained on robotic systems worldwide, and over 12 million, I think it's up to 14 million procedures globally through 2023, and 7,000 robotic systems around the world. And it turns out that, at least in the United States, the percentage of programs that do residency training that have involved robotics in their training is increasing. And you can see 100% of urology, general surgery, gynecology programs have robotics integrated into their training programs, such as when these surgeons finish their training, they're fully facile in robotics. Thoracic surgery, 94% of these programs have robotic training, and head and neck, 88%. And in the last 12 years, from 2012 to 2022, the growth in minimally invasive surgery has been due to robotic-assisted surgery, with a 13% decline in conventional minimally invasive and a 14% decline in open surgical procedures. This is across all specialties. And in a poll of resident applicants who would be coming out into their practice, 77% believe that robotic-assisted surgery would be very important in their future. 47% growth from new surgeons that were trained on the robot, and over 1,400 certificates were granted in the year 2021 to 2022 in terms of robotics. And what this shows is that there is a huge interest in robotic surgery in all of the different specialties in which it is deployed. It turns out that in the United States, 15% of all surgeries in all specialties are performed robotically, whereas in Europe, only 2% of all surgeries. I don't have those numbers for the rest of the world. And this is a picture or a graphic of the worldwide trend of installed systems. As you can see, United States continues to occupy about 70% of all robotic systems. And this is a major concept that I think a meeting like this will be able to address as we see the cost of these systems come down with more competition in the field. Worldwide cardiac surgery cases continue to grow, with intracardiac providing the bulk of those cases around the world, and revascularization a close second. And if you see the breakdown between United States, Europe, and Asia, it turns out that in addition to the United States that has seen continued growth between 2020 and 2021, there has been some significant growth in Asia as well. And this probably is related to the presence of various other robotic systems that are coming onto the scene. My personal journey in cardiac robotic surgery began in 2007. And we crossed the threshold of 2,000 cases about a year ago at the University of Chicago, and we focus on a multi-specialty or a multi-spectrum presence in cardiac surgery robotically, such that all procedures that we can do with the robot are done that way, whether it's coronary surgery or other epicardial procedures, including pericardiectomies and myocardial bridges and such, as well as intracardiac procedures, including mitrals, tricuspids, benign tumors, and more recently aortic valve surgery, with a big presence in electrophysiology. And this is some publications on that aspect of the multi-spectrum of it. Finally, I'd like to talk about robotic surgery in low and middle income countries and the potential benefits and challenges. This is an excellent publication that I encourage you to look at in the Annals of Medicine and Surgery that talked about the challenges in low and middle income countries, where the benefits would be that it decreases surgical site infections, decreases transmission of infection. In overcrowded hospitals, the shorter length of stay becomes extremely valuable. We saw this right front and center during the COVID pandemic. It improves the global imbalance in surgical care by affording telesurgery, which we will hear more about during this meeting. And it turns out that low and middle income countries are home to 50% of the world's population, but only about 19% of the world's surgeons. And so anything that can help improve the imbalance of this is going to be very important. There are challenges, obviously, disparity in access to robotics, the cost of the robotic systems, and surgeon training will all be important things that need to be resolved. But I think the efforts of Dr. Srivastava and the SSI team in taking these challenges head on is exactly what this conference is all about. And having a less costly robotic system that is available, and the prospects of telesurgery are extremely excellent developments in this field. You do not know how wonderful this feeling is to have a company that is actually devoted to cardiac surgery that will be able to help us in our procedures as we move forward. And then finally, the coronary anastomotic device, which is also being developed by SSI, that will, I think, promulgate beating heart robotic endoscopic surgery very quickly once it becomes approved and can be used in the clinical setting. So in conclusion, I will say that robotic assistance has absolutely revolutionized minimally invasive surgery in almost every specialty. The worldwide distribution of robotic systems is expanding rapidly However, there continue to be significant disparities in low and middle income countries. And as it stands, most patients who will benefit from robotic technology are unfortunately the least able to get access to it. And with the new robotic systems such as SSI Mantra, hopefully as they come to fruition, we will help navigate these challenges. And I think surgeons and hospital systems need to continue to invest time and resources in developing successful programs, take full advantage of this innovative technology in surgical care. Thank you very much again, and it's great to be here.